addiction system that works for all Ontarians, no matter how old you are or where you live. Throughout the pandemic, supporting the mental health and well-being of children and youth has never been more important. When children and youth are struggling, families and entire communities struggle. And we know the past year has been extremely challenging for children and youth, especially as we have had to adjust to remote learning. That is why our government is putting kids and families first by investing over $31 million in targeted supports for mental health and addictions treatment services for children and youth and their families. Our government is committed to ensuring these individuals are fully supported on their journey to wellness. This funding will improve access to specialized mental health services, shorten wait lists and wait times, and support the mental health and well-being of our province's most vulnerable children and youth. By ensuring children, youth, and families can access the supports they need when they need them, we can improve health outcomes and prevent costly and unnecessary hospital visits, especially as our hospital sector continues to respond to the pandemic. This funding will also help launch a first of its kind virtual walk-in counseling program, which is expected to support over 14,000 children and youth across the province. Today's investment flows through Roadmap to Wellness, our government's plan to build a comprehensive, connected mental health and addiction system that effectively responds to the needs of Ontarians at any age. This funding builds on our government's commitment to support Ontario's children and youth. Through Roadmap to Wellness, Ontario is turning a chapter. Built on 4 pillars, this roadmap lays out a clear path towards meaningful improvements to the care Ontarians receive, enabled by an historic $3.8 billion investment over 10 years that our government is investing to expand mental health and addiction services. This funding includes targeted investments to expand and enhance specialized services for children and youth, especially in underserviced areas like the Northwest and for Indigenous communities. In addition, we have invested up to $194 million in one-time emergency funding to immediately expand access to supports during COVID-19, including funding virtual programs. We know that this has been a very challenging year for children and youth, but you're not alone. Our government is here to ensure that Ontarians at every age are fully supported on their journey to wellness, because we all know that mental health is health. And I would now like to invite Minister Tobolo, Associate Minister for Mental Health and Addictions, to provide further details on this funding. Thank you very much.
Thank you, Minister Elliott, and good afternoon, everyone. Without a doubt, COVID-19 has had an incredible impact on the mental health of so many children and youth here in the province of Ontario, resulting in so many new and more complex challenges than we've ever seen before. As parents, guardians, siblings, and other relatives, we all want to provide everything that our children and youth need in order to lead a fulfilling and successful life. We also want to make sure that they are healthy, and mental health is an important part of that. From adapting to new methods of learning and spending time away from family and friends, this pandemic has been difficult for children and youth in every corner of the province. For example, we know that our youth are experiencing increased anxiety, depression, and suicide ideation, eating disorders, as well as more substance use. And that's why now, more than ever, we need to make the necessary investments to protect the mental health and well-being of our children and youth. Last year, our government launched the Roadmap to Wellness, our action-oriented plan to build a comprehensive, connected, and integrated system of mental health and addiction services that works for all the people of the province of Ontario. Our plan reflects the priorities we heard again and again through consultations with frontline mental health and addictions workers, experts, advocates, and individuals with lived experience and their families. Through our plan, we have been working collaboratively across all sectors to ensure that Ontarians can be matched with the most appropriate mental health and addiction supports that meet their unique needs. And our investments are bringing much needed mental health services for people of all ages across the province. As part of the $31 million announced today, this includes a $20 million investment for an across the board 5% funding increase for all core mental health and addiction services, as well as select Indigenous and underfunded specialized services. We're also investing $3.5 million for a live-in treatment program for children and youth with complex mental health needs. I'm also especially proud of the $2.7 million that will be going to youth wellness teams at 4 new wellness hubs through Wellness Hubs Ontario at the new service sites. This investment will see the province's youth wellness network grow with the addition of 4 new hubs that meet local needs for different populations, including the Francophone community and youth, and those living in rural and underserved communities. A key pillar of which our roadmap to wellness is built upon is investing in innovative solution. And that's why I'm also pleased to see $2.1 million in annualized funding going towards supporting the creation of a new virtual walk-in counseling program. This innovative program will provide children and youth across Ontario with immediate access to the services they need, while enabling an assessment as to whether further more intensive services are necessary. In addition, $2 million will be going towards a new program to help children and youth who require intensive treatment to transition in or out of specialized live-in treatment programs, secure crisis units, or hospital. And lastly, $1 million to maintain child and youth telemental health service levels, providing access to specialized psychiatric consultations through video conferencing for children and youth receiving services from community-based providers. By expanding access to mental health services for our children and youth, we're taking another significant step towards reaching our goal of building a mental health and addiction system where all Ontarians can receive the high-quality care they expect and deserve when and where they need it. Thank you very much, and I'd now like to pass it to Kim Moran, the CEO of Children's Mental Health Ontario.
I would like to thank Ministers Elliott and Thibodeau for today's investments. It's wonderful news. But before I start, I'd just like to acknowledge the grief and trauma our Indigenous communities are reliving after uncovering the 215 children in BC. It's a moment of collective pain, anger, shame, and grief. There is an Indian Residential Schools crisis line, and it's available 24 hours a day. And if those people need support, please call 1-866-925-4419. It has been an incredibly difficult year for children, youth, and families across the province. The enduring social isolation, the family distress, the loss of important events and milestones, the loss of regular routines like school, as a result of the pandemic, has huge consequences on a whole generation of children. I wanted to provide some context around the parallel child and youth mental health pandemic and about why investments such as what has been announced today are so very important. Before COVID-19, there was a crisis in child and youth mental health, with 28,000 children and youth on wait lists for mental health treatment. And for those with the most serious mental illness, they could wait up to 2 years. I experienced this myself as a parent, so I know firsthand how in the life of a child and for a family, every day waiting matters. Parenting a kid with suicidal thoughts or enormous anxiety is really hard, much harder than words can even describe. And to wait for care is incomprehensible because your child's life is at risk. If your child had a life-threatening illness like cancer, we don't delay treatment, and we shouldn't delay treatment for a life-threatening mental illness either. But sometimes that happens, and sometimes they wait, sometimes for up to 2 years. Too often, they end up in hospital in crisis, only to be stabilized and return to wait times for treatment. We know that barriers to accessing services are most profound for Black, Indigenous, and persons of color, those with developmental disabilities, ASD, and other vulnerable children and youth. The research has been quite clear. Social isolation, school closures, job losses, family stress have all increased the mental health issues of our children, particularly for those who had mental health issues previously, and those are the kids that are waiting too long for care. The mental health needs of children, youth, and families have never been higher, and a generation of children are at risk. We've seen data that says that serious eating disorders are on the rise. 2/3 of our youth surveyed are reporting their mental health has gotten worse, and youth from low-income families in northern or remote communities have had even worse declines. 60% of parents report significant behavioral changes in their children, like outbursts, extreme irritability, drastic changes in mood. There's been a higher demand for services at child and youth mental health centers, in some regions, a doubling of intake volume. We at Children's Mental Health Ontario envision Ontario, where kids and families can get the mental health treatment they need just as soon as they need it. And that's why this investment is so very important and an important step forward towards that vision. It will help child and youth mental health centers deal with the current volumes they're experiencing now and the expected surge in child and youth mental health needs over the summer, and especially as kids go back to school in the fall. As Ontario focuses on a recovery, we must include children's mental health and well-being as a key priority. I would like to thank again the province for today's investment. Our leaders look forward to working on Ontario's roadmap to wellness to simplify getting mental health care and to reduce the waits for families to access mental health care they so desperately need for their own recovery. Thank you very much.
Thank you, Kim. We'll now move on to the media Q&A. A reminder for members of the media that it's one question, one follow-up. Operator, first question, please.
First question from Randy Rath at Sage TV. Please go ahead.
Hi, thanks for taking my question. Minister Elliott, NACI has revised their guidance for the use of the various vaccines, essentially saying that it's safe and effective to mix and match the vaccines as you would like. What is this going to mean for vaccine use in the province? And are people that got a AstraZeneca shot as their first shot now able to choose to have a different type of vaccine as their second shot?
Well, thanks very much for the question, Randy. And yes, NACI has just come forward with recommendations. With respect to the use of the mRNA vaccines, that would be Pfizer and Moderna. So while they are recommending that if you have your first shot of Pfizer and the second shot of Pfizer is available, you should follow that. However, if you received a first shot of Moderna and there might not be potentially Moderna available, it's okay to substitute a Pfizer shot and vice versa. But we're still waiting for their advice about second doses if you've had a first dose of AstraZeneca, whether you can mix that with either Pfizer, Moderna, or any of the mRNA vaccines. So we're still waiting for their recommendations on that point.
Follow-up?
Okay, thanks. The regulations were changed yesterday as far as AstraZeneca goes, that anyone that received their first shot on March 20th or later will have to wait the full 12 weeks to receive before they can receive their second shot. What does that say to people who followed the government's advice and rushed to get a shot after only 10 weeks and feel that they've been let down and given substandard health care?
I would say that they are still receiving very high quality health care, and that a shot at 10 weeks has also been recommended by NACI as being perfectly valid and perfectly effective. The gold standard is 12 weeks, but 10 weeks is also very, very safe. And part of what has to be done here, Randy, is the actual physical movement of the vaccines from the three areas where they are right now, which is the Kingston area, Windsor and Toronto. It's physically getting the vaccines into other parts of the province. So that's what's taking some of the time in order to be able to do that. So there are some logistical challenges there, but 10 or 12 weeks, it's both very safe and effective.
Next question, please.
Next question from Rob Ferguson at the Toronto Star. Please go ahead.
Rob.
Hi, Minister. Just to follow up on Randy's question. So since it seems virtually certain that it's going to be recommended that people who got AstraZeneca could get a second dose of mRNA vaccine, what would the interval be on that? We know that the most effective interval for AstraZeneca with the second dose is 12 weeks. How would that change with an mRNA vaccine as a second dose?
Well, we're still waiting to receive their recommendations on if those vaccines can be used as a second dose for AstraZeneca, and then the NACI will be advising us as to the appropriate time period for which those doses to be administered. So we're still waiting for that information.
Sorry, follow up?
Yeah, okay. Thanks on that. And I continue to get deluged with questions from AstraZeneca people about having trouble getting second doses. You know, their pharmacy isn't getting, where they got their first dose isn't getting more and whatnot. Is there anything happening to make that easier? And when will that shipment of 254,000 vaccines that came in a couple of weeks ago, when will you start releasing that?
Well, we anticipate that they will be released very soon, and they will be released across the province because there's more. We started with the 3 locations in Windsor, Essex, Toronto, and Kingston because that's where the first doses of AstraZeneca were first given. And so that the appropriate time period had passed, but we will now be distributing the AstraZeneca vaccines across the province, including into more pharmacies. Right now, it was more limited because of limited numbers of vaccines, but with the 254,000 that we have, we will be distributing them more broadly. So if people weren't able to get their second dose through the pharmacy where they received their first dose, they can certainly check our website at ontario.ca/coronavirus, and they can then find out which pharmacies in their area do have the vaccines available, and they can book their appointment directly with that pharmacy.
Next question, please.
Next question from Laura Stone at the Globe and Mail. Please go ahead.
Laura.
Hi, Minister. I'm not understanding why you're saying you're waiting for NACI's guidance. They've released the guidance. It says provinces can now give an mRNA vaccine to those who have received AstraZeneca as their first. So is Ontario still going to give the option of people getting AstraZeneca for their second dose, or are you going to go the Manitoba route and just recommend mRNA vaccines?
Well, it's what people feel comfortable with, and we haven't seen really any vaccine hesitancy with respect to the AstraZeneca for second doses. People want to receive it, so but they will, of course, at some point have the choice. And it's a question of making sure that we'll have the mRNA vaccines, of course, at mass vaccination clinics and other places. The AstraZeneca is available at pharmacies. So people will be able to make their own decision about which dose they wish to receive.
Follow up?
Okay, thank you. And on schools, multiple reports today that says Premier Ford is leaning towards not reopening them, and that this will go to cabinet decision tomorrow. But can you just explain how can it be that the government is now leaning towards not reopening schools and potentially reopening the economy earlier than anticipated?
Well, I can just say that the issue about opening schools is a very important decision for children and families across the province, and that's why the Premier has sought the guidance and expertise of many different groups, including pediatric hospitals, public health groups, and other organizations. It is something that they are taking time to review the information that they receive back to be able to make a decision that is going to be in the best interests of Ontarians and safe for all children. So they're just taking the time to review the information, the Premier with Dr. Williams and Minister Lecce to come to a recommendation.
Next question, please.
Next question from Natasha MacDonald at Radio Canada. Please go ahead.
Hi, just to bounce off of Laura's question, can you confirm, though, that the reports that both the Premier and Cabinet's Policy and Priorities Committee want to keep schools closed until the fall?
No, I can only confirm that this is something that is being taken very seriously by the Premier, by Minister Lecce, by Dr. Williams, and they are continuing to review the information that has been provided to them as a result of the letter that the Premier sent out to a number of different individuals and organizations over the past week.
Follow-up, this will be the last question, by the way.
We seem to be close to hitting all necessary thresholds. So can you say whether it's likely the province will enter stage 1 of reopening sooner than later, by the end of the week even?
We're anticipating that we will hit the milestones that we need to hit by June 14th. We do not anticipate it will be any later than that. Whether we hit those markers sooner, I guess, remains to be seen. We know that we've hit the vaccination rate, which was 60% of adults over age 18. However, there are also public health indicators that also need to be taken into consideration, such as the number of new cases, the number of people being hospitalized, people being admitted to intensive care units, and the R rate as well. So there are a number of issues that need to come together. We're watching them all very carefully, but we have been advised that the targets that we have set out for all 3 stages of our plan to slowly reopen Ontario are both realistic and achievable.
Thank you, everyone. That concludes today's announcement.
Thank you.